Did you know that taking medication for your migraines can actually make your head pain worse? It's a classic situation of too much of a good thing. If you use migraine medication too often and too regularly, it can increase your system's sensitivity and create what's called medication overuse headache. The surprising thing is that it can happen not just with the stronger medications like triptans and opiates, but with simple analgesics and anti-inflammatories too. Triptans are medications like Migraine, Zomig, Relpax and Maxol, just to name a few. You're at risk if you take over-the-counter medications like paracetamol or ibuprofen more than 2 to 3 days a week, and triptans for 2 days of a week. And that level of usage is really quite common with headache and migraine sufferers. So it's really easy to see how this situation happens. And all it takes is a gradual increase in medication as the previous one isn't quite as effective, or someone is using medication preemptively just to make sure they don't get a bad headache on an important day. The advice with triptans is to take them at the early signs of a migraine because they work best in the early stages and not once the head pain has set in. And yet, talking to migraine sufferers, it can be hard to know which early signs will actually eventuate into a migraine and which won't. So they take the triptans because they can't afford the time out of life with a full-blown migraine. So with medication overuse headache, prevention really is the key. It's much easier to prevent it than it is to treat it. So if you're taking any of the acute medications regularly twice a week, you are at risk. And you might think to yourself, but I really need them just to get by, and if I don't take them, I'm in trouble. But you need to act on it. And the first step is to see your GP and highlight that you are concerned about this pattern of headaches and the medication that you're using, and maybe use the term medication overuse headache. And the other step is to find out if there's an underlying reason for the headaches or migraines that hasn't been looked for or hasn't been found. And this is where we can play a huge role as physios that practice the Watson headache approach. For example, if there's contribution from the upper neck that's playing a significant part, by getting this addressed, it can prevent the need for regular medication. Now, unfortunately, a GP or a neurologist isn't equipped to do that kind of manual examination of the upper cervical spine, which does take experience and specialised skill to determine what is relevant and what isn't. So if you see one of our Watson headache trained physios, we can easily assess if your upper neck is contributing, and if so, treatment should see a fairly rapid change in your condition, typically in a handful of sessions. So message us if you're interested in finding out more about the Watson headache approach or non-pharmaceutical solutions for your migraines. Cheers.